ViScope has been developed with more than 10 years of core research by collecting tens of thousands of heart sounds in our database, and we have worked with clinicians in UCSF, in all over America, Asia, in Singapore, India, as well as in Europe, and we have collaborated with them closely to develop this product so that they really get what they really want. So this is what the ViScope ECG does. You have recorded the sounds for 10 seconds, and then it shows the ECG trace in the bottom, and then there is heart sounds, which shows the lub-dub or the S1 and S2 sounds. And then also there is a murmur trace, and in this case the patient is normal, so there is no murmur present. In this case, the patient has an abnormal heart valve. He actually has a mitral regurgitation, that is the leakage of the mitral valve. So you can see the pan-systolic murmur, the big murmur present in the entire part of the systole, and you can clearly identify the S1, the first heart sound, coinciding with the QRS waveform of the ECG, as well as the S2, and the murmur is between the S1 and S2. And you can also notice S3, the third heart sound, which is next to the S2, which is very hard to hear. The device also has a tube where, using our proprietary technology, we have reduced the noise to a great extent, and the tube also lasts for several years. And in addition to that, we have a patented diaphragm which acts as both a bell and a diaphragm, and it can also work for pediatric studies and so on. The ViScope device also has a USB port from which you can transfer the sounds to the PC, and you can analyze these sounds at a later point. And the same port can be used to charge the device. It's got a rechargeable battery inside it. So when you charge the device, it gets charged within 5 hours and it lasts for more than 1 day. This is the ViScope ECG, where we enabled 3-lead ECG on the same device. You can connect these 3 leads, which are actually detachable, and if you connect them and you can place them in the regular electrode positions, it can detect a single lead 2 signal on the display, and that can really help in timing the heart murmurs better.
I have been using the ViScope stethoscope for over 10 years now, and now it's an integral part of my practice. The first area that I would emphasize is that my patients find this highly acceptable. It really enhances the doctor-patient interaction by showing the patient that we focus very, very carefully on their physical examination. We have an ECG integrated into the display of the device. So this allows timing of the heart sounds. Even if you weren't going to look at the heart sounds, you can time them with the ECG display. The second thing that the device offers is a very high quality phonocardiogram, which is a continuous display as you're listening. The other feature of the display is a murmur detector, which is really not so much for the experienced examiner, but perhaps someone who is a little less experienced in auscultation. So these are all very valuable things that this device brings.